Hello, I'm Dr. David Wootton. I'm a chiropractor. I practice in Memphis, Tennessee. I'm the longest active practitioner utilizing spinal decompression in the United States. I actually started doing this back in the early 90s. And I want to tell a little bit of history about how spinal decompression developed, in that I had some personal knowledge with the developer, Dr. Alan Dyer. Dr. Alan Dyer was the former Deputy Minister of Health for Ontario, Canada. He was a medical doctor. He married a medical doctor. A little bit about Dr. Dyer: when he was in med school, it was assigned to all the students to write a thesis paper, and he wrote in his thesis paper that because muscle responds to electrical impulse from the brain, that if the heart, for example, which is a large muscle, had stopped beating, then if you stimulated that muscle with a strong impulse of electricity causing the muscle to spasm and contract, you could potentially stimulate the heart to begin beating again. The school had a policy at the time that they purchased all thesis papers for $1 and then they owned them. They took his thesis paper, bought it for $1, and now we have what's called the atrial defibrillator. Brilliant man, loved to research. That was just his mentality. Very smart individual. He married a medical doctor who she ultimately had developed a herniated disc in her back. She sought out medical care. They made numbers of recommendations for her treatment-wise. Ultimately, they said, you're going to have to do surgery on this disc to fix it. She did not want to do back surgery because she, being a medical doctor, knew what the outcome of so many back surgeries are and the side effects. And so she went to her husband, Dr. Alan Dyer, and said, if you can figure out how to get a heart that has stopped beating to start beating again, then you can figure out how to fix my herniated disc. Get busy. And so he started with traction. And traction was used for a number of years. And traction was effective in some cases because it did lower the pressure in the disc. And there was benefit to doing that. But what he found is that when we're in a standing position, the pressure inside the disc is around 100 millimeters of mercury plus. If you were to sit down, the pressure inside your disc goes up to 110 millimeters of mercury, thereabouts. If you were to lay down, the pressure inside your disc drops to about a plus 80 millimeters of mercury. What he found with traction is they could take that pressure in the disc from a plus 80 millimeters of mercury down to a plus 30 millimeters of mercury. That decrease in pressure was enough to help some people with discopathies in their spine. Dr. Dyer began to experiment with the rate of pull on the spine. And the reason is he found that when he did traction, the muscles around the spine were tightening to protect the spine. Now that's a normal reflex of the body. The muscle fibers, the tendons, have within them what are called proprioceptors. And when you stretch the muscle, there is a point where the muscle then will fire an impulse to the spine to let the spine know it's being stretched, and then the spine sends an impulse back and causes the muscle to tighten to protect the spine. That's a primary reflex. And so Dr. Dyer began experimenting with the rate of pull, and what he found is when he decelerated the pull as it pulled firmer at a very specific rate, that he could override that normal reflex of the body, and the muscles did not respond and tighten with a decelerating pull. Now he found the optimal rate of speed of deceleration, and he called that a logarithmic pull. It's a decelerating pull that never allowed the reflex to happen. So now the muscles were staying relaxed, and the entire pull was now going to the disc space. He stuck a probe into live patients when he was doing his experimenting, and he found that he could take that pressure inside the disc not only down to plus 30, but he could take it all the way down to 0 millimeters of mercury pressure, neutral state. He could never get the pressure below 0, no matter how hard he pulled. And so what he realized is that the probe that he was using in the disc space only read positive numbers. And so he contacted Hewlett-Packard and asked them if they could develop a probe that would read both positive and negative numbers, which they did for him. When he stuck that probe in a live patient, as he did his pull, he was then able to take the pressure inside the disc not only below zero, but down to as low as a minus 150 millimeters of mercury. So he knew he was now onto something. And he would increase the pressure to 150, 200, 300 pounds of pull, but never could get that pressure below negative 150 millimeters of mercury. So the deduction is that the motor unit had stretched as far as it could stretch with the ligaments surrounding the tissue and the connective tissues, and therefore that was the maximum amount of vacuum that could be created in the disc space. So that's how the actual treatment began, and he developed it. He put his wife on there, it fixed her herniated disc, and he knew he was onto something. Dr. Dyer went on to treat a number of patients in Ontario, one of which was Mario Lemieux. Mario Lemieux at the time was a famous hockey player and had developed a herniated disc. Dr. Dyer worked with him, resolved his disc, and it made all the papers. And then Dr. Dyer became a well-known name for working with discopathy, disc herniations, etc. Because of that, a friend of mine, Dr. David Singer, who I was a client of at the time, was dealing with a herniated disc. And when he would sit down, within 5 minutes, his leg would start to go numb. And he had done everything, chiropractic, PT, everything short of doing surgery on the disc. He also did not want to do surgery if it could at all be avoided. And so he flew to Canada, did 2 treatments per day with Dr. Dyer, and at the end of his treatment regimen, hopped back on a plane to fly back to the United States, and within 5 minutes, his leg was numb. So he thought he'd wasted the entire time in Canada, and flew on back home. The next morning when he got up, he sat down to eat breakfast, and within 5 minutes he realized his leg was no longer numb. And he, from that point forward, did not have any issues at all with his disc. And so David was then sold on the efficacy of spinal decompression in working with disc herniations. Dr. Singer had his top 10 practitioners at the time in his client services, and he asked us to come to his penthouse. He showed us a video of spinal decompression, gave us an overview of how it worked, told us it was the best thing since sliced bread for herniated discs. And of those 10 practitioners, I was the only one that purchased a table, that saw the efficacy of it and began treating. So I bought the only table, I started practicing, and then from there we now have literally hundreds, if not thousands, of practitioners utilizing spinal decompression around the world. Dr. Dyer came to my office after I purchased the table. He brought his wife with him. They instructed us specifically on how to set the patients up on the table. He gave me a long history of his research. He had done 15 years of research at that point. Channel 3 News came out, interviewed Dr. Dyer, interviewed myself, and we began treating patients, and it has been just an integral part of my practice since the early 90s. We have now treated hundreds, if not thousands, potentially I think close to 10,000 different cases of disc herniations, bulging discs, etc. With the treatment, and it by far is the best treatment available conservatively to help resolve a disc problem.